Dr. Husain. I'm a GP in Newcastle and I'm also part of Newcastle Central PCN, and today we've done our first COVID vaccination clinic. We're aiming to clear about 1,100 patients over 2 days, and it's going very well so far. But I thought I'd share a bit of information to give you guys some facts and debunk a few myths regarding the COVID vaccination. So firstly, in terms of how vaccines work, so vaccines are specifically designed and then trialed to give you an injection that stimulates your immune response. So what that does is it doesn't actually give you the infection or virus that it's protecting you from, but it lets your body stimulate antibodies, and these are what protect you from infection. So later on down the line, if you're ever exposed to this virus and you catch the virus, the body knows how to fight it. And as a result, the aim is that you don't get as poorly, you don't end up in hospital, severely unwell, or obviously, you know, the end worrying stage is obviously death. So that's the main aim for the vaccine for COVID. Now, there's two types of vaccines at the moment. There's an AstraZeneca vaccine and a Pfizer vaccine. Now, the way they work is slightly different, and I'm not going to go into any specifics, but in terms of safety, they're both equally as safe and they are equally as effective. So different groups may get offered a different vaccine, and to be honest, you know, whatever you're offered, you know, just take. I wouldn't get too bogged down in terms of deciding which one to go for over the other. And obviously we're quite fortunate in the UK that the vaccines are being enrolled out and they're free of charge. They're not offered privately, and if you ever get any messages from anybody offering you the vaccine and to pay for it, then that's likely to be a scam, and please ignore. The vaccines at the moment are being booked in by surgeries by priority age, so please don't contact your surgery will contact you. And we will start obviously with the over 80s group and then move down via age and risk. And also frontline healthcare workers will also be offered the vaccine early. So the main myth you hear is, will the vaccine give you coronavirus? The answer is no. It does not contain any coronavirus particles, so it won't cause you to have coronavirus. Apart from, you know, a temperature, body aches, a sore arm, there's no specific worrying side effects that we're aware of, and obviously all the studies have demonstrated that the vaccines are both safe. Anybody with a high risk of allergy, or what we call anaphylaxis, is screened beforehand. So obviously from our screening process, if we don't feel you're suitable for the vaccine, we won't offer it to you. And afterwards you are observed for the Pfizer vaccine for 15 minutes. So obviously the process is very safe. And like I said before, the safety data is good for short-term side effects. Just for my Muslim brothers and sisters out there, the vaccine doesn't contain any pork or any ingredients that would make it haram, so it's halal and permitted. And also, you know, the benefit of having the vaccine outweighs any harm, so, you know, it's highly recommended, and all the scholars and multiple schools of thought would obviously recommend the vaccine. So there's no concerns about it not being halal. Just changing subject a bit, I'm just going to go through a quick few other points regarding COVID that I think is important to discuss. Firstly is how to put a face mask on properly. So we've all seen these. So these are the surgical masks that most of us use. So keep the blue part on the outside. You've got a soft bit at the bottom and a bit more of a stiff bit at the top. So hold it from here, put it on, flick it up. Now I see people walking around with a mask like this. It's not covering you, you may as well not wear it. It has to cover your mouth and your nose, because you breathe from your mouth and your nose. And obviously the virus is obviously transmitted through air particles, so if you're not covering your mouth and your nose, you're putting yourself at risk and putting others at risk. So please, 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 if you're going to wear one of these in a hospital, in a surgery, in a public area, in a shop, like this, and then pinch it, and great. So that's how you put your mask on. Covers the mouth and the nose. Yeah, it feels a bit unusual, you get used to it. Obviously, people are downloading mask exemption certificates. Again, I would say, look, unless there's a very strong medical reason, and to be honest, as a doctor, I can't think of very many, please wear a mask. If you can't tolerate a mask for long conditions, you can have the visor shield instead, but please, this is your best friend, okay? They do work, and obviously, you know, wear them properly. Try not to, you know, make excuses of not wearing. You know, there's only a very limited group of patients that shouldn't be wearing a face mask. And you've got to think of it this way: if you get poorly, you know, asthmatics and COPDs get poorly, people with coronavirus get poorly, how do we treat it? We give you oxygen more often than not with a mask on that you have to wear all of the time. This is short term, so short term keeps you safe, okay? A couple of other things. If you have a cough, it's winter, I know there's other viruses going on, or, you know, bacterial infections, but any cough, till proven otherwise, is COVID, so get a swab. It's very easy to book a swab at short notice. You can drive through, get a swab. Don't assume it's not COVID. We've had patients thinking it was something else, and the results have come back positive. Myself, if I was to develop a cough or a sore throat or any minimal symptoms, I get a swab. There's no point risking it, and there's no harm in getting a swab either. The second thing is, obviously, if you develop COVID and you're positive and you become unwell and you need the hospital, please attend. So if you're very unwell and you call an ambulance and they advise it, or your GP advises it, please attend A&E. There's a conception that people are entering hospitals and not coming out because they're dying. That's due to the severity of the illness. It's not due to anything the doctors or the nurses are doing, or the hospital environment are giving them additional illnesses, or giving them a stronger version of COVID, or giving them the wrong medication. No. The hospital gives these people the best chance of dying, and unfortunately COVID has taken no prisoners, regardless of age, ethnicity, gender, body type. Young and old are dying because this illness is very severe. So please don't suffer at home, and let the professionals do their job. The last thing is, obviously, especially being in the ethnic group, being Asian, the BAME group, we're already at risk. Things you can do to minimise your risk, as well as wearing your face mask and gelling your hands and staying indoors as much as possible, is vitamin C and vitamin D. You can get them from a supermarket, you can get them off Amazon, a full 12-month supply. Take those proactively. They are your best friends, they will work, they will give you some protection. On top of that, obviously, the vaccine will be offered. And the last rule is, obviously, keep to your household bubbles. Don't mix with your friends or extended families. You're just spreading the virus. You don't know where they've been, they don't know where you've been. And obviously, you know, it is spreading very rapidly. Also, attending mosques, stick to the mosque guidelines. If you're unwell, or you have a cough, or you're waiting for a COVID swab result, don't go. It's selfish. In my view, it's haram, because you're putting others at risk when you could be praying at home. Please don't risk it. And if you're unsure, speak to a friend, speak to the GP, you know, and they'll be able to advise you. And most importantly, look out for one another, stay safe, and God bless you all.